In the age of internet, people could be looking at this videotape because they've just taken a loved one to the emergency room after a concussion with or without a period of loss of consciousness. And based on your experience, what are the kinds of symptoms that people should be looking for after a concussion?
Well, in the cognitive sphere, it would be confusion, just being not as sharp, like people describe this cloudy feeling. And the way that I describe it to family members, it's kind of like one of those snow globes. You know, when you shake it up, it gets snowy and blurry, and that's what happens to the brain actually. You know, it gets blurry, and gradually that snow settles and it becomes clearer. So that sense of cloudiness, not being as sharp, memory, you know, short-term memory being impaired, slower processing speed, and then headaches would be more of a physical symptom. Ocular motor issues, you know, getting headaches when they read, or having really poor reading comprehension or slowed reading, or
Nausea?
Nausea would be another physical symptom, right?
Does that differ between children and teenagers and adults, the kinds of things you look for?
Yeah, I mean, children is a whole different ballpark because a lot of the functions that we would measure, like especially frontal lobe functions, wouldn't even be in existence in their brains because the frontal lobes don't fully develop now, we know, until the early 20s, right? That impulsivity, you know, the limbic things are shooting up, those limbic impulses, and they haven't got enough frontal lobe to sit on top of it and direct it, right? But children, you know, it's really interesting because generally speaking, the older you get, the harder it is to recover because your brain is more hardwired, right? It's less flexible the older you get. So older people have a harder time recovering fully from head injuries. Kids' brains are remarkably flexible, right? So in one way, they're a good candidate for rehabilitation, but it depends on the age. If the kid has a head injury before the age of 5, that can have really deleterious consequences because so many functions haven't even been developed. Like, you know, one of the cases we worked on with the child who was less than a year old,
yes,
and was injured in a car accident because of a faulty car seat.
You know, and by deleterious, you mean not good.
Yeah. Less likely to, you know, because functions such as language haven't even developed yet, right? So if the brain is injured and those pathways can't be established, it's very difficult, right? But the positive side of working with kids is that their brains are, and I would say kids like over the age of 5, their brains are more flexible, more resilient. They're more able to hop over and use their right hemisphere when it's typically a left hemisphere function.
But at the same time, the degree of the injury will have a major influence on the outcome on it.
Yes, absolutely. And teenagers is a unusual period because, you know, a lot of those basic functions have been developed, but frontal lobe hasn't. And one of the things that mild head injury people feel is that they feel different, you know. And one of the developmental tasks of adolescents is to bond with your peer group, to move away from the dependency on your parents. So now we're talking psychology, right?
Right.
You want to, you know, bond with your peer group, move away from dependency. But the mild head injury can make you more dependent on your parents. So it's kind of working against what your developmental task is. That can create all kinds of psychological problems, depression, low self-esteem, anxiety, which, you know, and if that's present, that's another factor that's going to affect brain recovery.
You promised earlier to talk a little bit about the relationship between the psychological component of the recovery from a brain injury
Right.
and the brain injury itself.
Right.
Seems like we're at that natural point.
Yeah. Yeah. I mean, that's because before I was a neuropsychologist, I was a clinical psychologist. So I'm very interested in personality. Some of my early research was on the brain underpinnings of personality. So even pre-accident, premorbidly, someone's personality is important to understand. And that's why I argue against some of these really quick computerized batteries that don't take this into account. So if someone before an accident is a little bit on the obsessive compulsive side. So let's say you're a successful attorney, you're probably more on the compulsive side, right? You like your T's crossed and your I's dotted, you like things organized, you like to be in control of things. If I give you a head
And you've been talking to my wife.
if I give you a head injury, you're gonna be anxious because your personality style is being messed with. You are not in control of things. Like if you forget 3 things at the grocery store, that's going to grate on your nerves because you're used to being exacting and carrying out those spousal commands, with
Right.
great accuracy, right? On the other hand, the same amount of head injury in someone who's, let's say, a histrionic personality, different personality type, premorbidly, right?
What's histrionic?
Histrionic is someone who's like really gregarious, like the life of the party, someone you like to go out and have a beer with. They're going to be lively, maybe garrulous. They like the attention. That kind of thing. That same level, like that, if they had that same level of brain injury, it wouldn't impair them. It wouldn't impact on them as much. What would impact on them as much is maybe if they had that word retrieval problem, so they couldn't speak or they couldn't tell a joke or, that they messed up the punchline, that kind of thing. So that might have a greater effect on their self-esteem. So understanding who it was that had the brain injury, who they were beforehand, and this is where interviewing with family members and getting a sense of knowing their occupation and what they did and that kind of thing is very important. And some of the personality tests that we give measure premorbid personality, not symptoms that you have afterwards, right? The other things in terms of premorbid, while I'm at it, if someone's had a previous head injury, they're more likely to have protracted symptoms. Now, if someone had a previous mild head injury 20 years ago, that's not so much the case. But as we know with football players and the NFL concussion protocol, if you've had a head injury within a week or 2 beforehand, you might be withheld from playing because we know from evaluating before we realized what was happening, these players that would go in after sustaining a concussion and sometimes even finish out the same game, and then get concussed again, that's when you have, major problems with dementia, later on. So premorbidly, we want to know about personality, occupation, where they were in their life, their social functioning, that kind of thing, as well as health. So premorbid depression. Totally unrelated to personality type, but premorbid depression is a bad prognostic indicator for recovery from a head injury. And then after the head injury, it's really important to understand the role of depression and anxiety because that messes with recovery. And so often that's not covered. That's just, it's not talked about or it's not dealt with. The family has to deal with it. That's why family counseling is really important. And these rehab programs that we talked about they have support groups for family members so that they can understand what's happening.
In your experience, are they important, those family groups?
Absolutely.
There's some studies, and correct me if I'm wrong, there's some studies that show that families that participate in the rehab and the care, that those patients do better.
Absolutely.
Why is that?
Well, support. I wish I had one of my slides from a canned talk that I give, but out of all of the variables that best predict recovery, IQ, age, all of the things that we've talked about, intelligence, a level of occupation, income, all of those things, family support is number one.
Why do you think
in
that
terms
is?
of predicting? Because they're providing through that support an optimal place for the brain to heal. They're minimizing the depression and the anxiety and the emotional things that can mess with recovery.
Some housekeeping things. How soon after a brain injury is it appropriate to test?
Yeah, I would say, a week, 10 days, because most people by that time from those immediate symptoms or, post-injury are going to begin to recover. That recovery period, by the way, can extend out to 3 months. When we do large-scale studies of football players and also returning vets that have had head injuries in the line of duty, it seems like by 3 months, most of the mild head injuries have recovered. So there's an argument for waiting until that time, but the problem is with that is that the sooner you get working that brain through rehab and through exercises, the better it is. So you might not want to wait that long.
If you wait that long, 3 months to start getting rehab, you may have lost opportunities.
Yeah, exactly.
Other housekeeping matters. Do you use different testing methods and treatment recommendations for the different age groups, children, teenagers, adults?
Yeah, children, it's a completely different battery. The IQ test, the Wechsler Intelligence Scale, is the same. It's the same kind of test, but it's totally different for a kid, obviously.
Right.
Some of the language tests we wouldn't use, but there are, generally speaking, we can cover those areas: executive function, motor and sensory, memory, language, and personality functioning. We can cover all of those same areas, but with kid-modified tests.
Do the timelines for recovery differ between children, teenagers, and adults?
Well, adults, as I said, it's going to be longer, and it depends on so many factors: their premorbid health, depression, family support, their cognitive reserve. We all have a cognitive reserve, so as we age, we sort of utilize that to help us, combat the normal effects of aging. But the head injury is kind of speeding up the process of aging in some ways. So adults, they're going to have a more protracted recovery, less likely to have a full, to feel like they're fully back to where they were. Adolescents and kids over the age of 5, they're gonna be more likely to have a good recovery because their brains are more adaptable, flexible.
Again, depending on the extent of the injury. Over the years, I've been involved in some difficult
Catastrophic.
Yes.
Yep.
Cases. And they are talking about severe or the so-called moderate to severe injuries.
Yeah.
What do you wish more people knew about brain injury recovery?
Well, we actually just covered it in that question that you asked me about the psychological factors. Because I think, as a neuropsychologist, I've always been very interested in the psych part of neuropsych. And today, unfortunately, neuropsychologists are being trained without the adequate training, let's say, in therapy or personality assessment. So they don't really understand the impact of those things or about working with the emotional, reactions that people can have to when their life is turned upside down, that kind of thing. So, yeah, I really think that we covered the psych part of it, that family support is really important, dealing with depression and anxiety, because those things can, impact recovery rates. And then understanding premorbid personality and how the nature of that particular brain impairment might have a different meaning for someone based on who they were beforehand.
I just want to pick up on something that you said earlier as it relates to your last answer. Much earlier you talked about concerns that you have about group testing, and also you made a reference to quick computer-generated testing.
Right.
When you're telling us something, I'm not quite
sure
on it.
Well, thank you. I can get on my soapbox.
Okay.
But there's a press, especially with insurance, to make things quicker. It's very expensive to have a whole day of neuropsych testing. So they've developed, quickie, an hour computerized testing, which they actually use at the NFL. At least they used to. I don't know if they still do, because it's gotten so much criticism. They will do, for instance, group testings, with high school athletes, taking 30 kids in a classroom, taking this impact, it's called IMPACT, impact computerized test, to measure their brain functioning before they start to play at the beginning of the year. And, with a group of adolescents, taking a test, 30 kids in a classroom, they're throwing spitballs and they're looking at, someone else, how they're answering the question, and no one's monitoring it. It's just, the results are barely valid. And that's been shown. It's not just my opinion, but it's been, they're of questionable validity. So in terms of the way they're administered, but even in terms of the level of things that they can assess, because it's all done in an hour and it's all done on the computer. So it's all visual, right? Because they're looking at a computer screen. They're not measuring auditory, they're not measuring tactile, they're not measuring kinesthetic and all the other senses. So it's very limited. I understand the need for it, and in one way it's good that they're testing, they're testing people, beforehand. They were using it in the NFL. I don't think that they still are. I hope that they're not, but Peyton Manning was quoted as saying, oh, that test, he termed the term, or I think the term was associated with him. I'm not sure he actually used this term, sandbagging the test, which means that because these players don't want to be withheld from play.
Right.
So he says, oh, with that test in the beginning of the year, I just bomb it on purpose, because then if I have a concussion, I'm going to look the same way afterwards, so I can go out and play, right? So there's no opportunity with tests like that to measure validity, like how hard someone's trying.
We were talking about insurance companies using these tests. Insurance companies are trying to do evaluations of whether someone has a brain injury or not.
Right.
And using a quick computer-generated test, in your opinion, does that give a full picture?
No. It's biased against not finding an injury, because, as I said before, like the difference between what a neurologist does and what a neuropsychologist does, we're using a fine-tooth comb. We're using the most calibrated measures of all kinds of brain functioning, not only cognitive, but emotional and behavioral. The computerized testing is just, it's a step in between what the neurologist does and what we do, but it's not nearly as comprehensive. So you're more likely to miss subtle deficits.
So the bias is to not be able to fully diagnose the function of the brain.
Absolutely. Yeah.
Well, now that we know that you don't have any particular opinions about those tests, let me ask you this as my final question. What gives you hope when working with patients recovering brain injuries?
Well, I'm just amazed over 40 years of working with people how resilient they are. So they have deficits, they have an injury, an impact. I can see the deficits, I can see how it impacts them and their family. And I've just been amazed at how people come back, you know, from an emotional perspective, like their perseverance and their can-do-it attitude, but from a cognitive perspective, how the brain adapts. I mean, it's really an amazing, it's an amazing piece of machinery.
Thank you, Doctor.
Sure. Thanks for having me.
It was fun.
Yep.